Hey everybody, my name is Dr. Sean Price, clinical coordinator here at Cairo Spa in Fort Walton Beach. And in this video I want to go through and explain what we do in our office that makes our treatment protocols and our overall body and overall system approach to healing, what makes it so effective and what makes it different from what you probably experience in other places. So first of all, we have a three-pronged approach to our basic foundation. The first thing is we look at metabolism, or the metabolic aspect of healing. Now, metabolism is basically taking food and converting that into energy. So you take food and you convert it into energy. The way that we analyze the metabolic process of what's going on in the body is through functional nutrition or functional medicine. Using functional lab values, we also use a very extensive questionnaire system that we have developed so that we can analyze how each organ system is functioning. And we also use in-office evaluation techniques. So we evaluate the metabolic process through labs, through questionnaires, and through in-office techniques, in-office exam procedures. So that's the metabolic aspect of care. Now, metabolism, again, is taking food and converting that food into energy. The brain actually consumes 30% of all of the energy that is created in the body. So when that energy is created, the brain consumes, and the central nervous system consumes 30% of that fuel. So what does that mean? That means if you have a metabolic issue, say a thyroid condition or IBS or Crohn's disease or diabetes or some kind of an autoimmune condition, some kind of a condition that's affecting you systemically and affecting that metabolic process, that means that the brain, that 30% of the fuel that the brain is getting, is not optimal. It's not ideal. And so what that does is that leads the brain to stop functioning properly, okay? And the bad part about that is the brain, in turn, goes back and controls the metabolic process. So it starts a downward spiral. So what we do, the second pronged approach that we take, is we look at the brain and we use what's called functional neurology. We work with brain function to try to restore brain function through neuroplasticity using fuel and activation to get the brain to start functioning again. People who are suffering with different issues like brain can be things like depression, balance disorders, brain fog, short-term memory loss, again, vertigo, balance disorders, all mood disorders, all kinds of different things can be affected when you start having brain dysfunction, neuropathies, so on and so forth. So we've got metabolic function and we've got neurological function. So the way that we analyze this is we do a complete neurological evaluation when our patients come into our office. We go through and test all the different neurological systems to see where the brain is not functioning at its best. And then a third aspect of care is going to be structural. Now, structural, this is going to be your postural rehab, your strengthening of your musculoskeletal system, getting you in a good posture, like I just said. Also, the spinal vertebrae, making sure they're aligned so that the signal can get from the body, from the brain to the body, and from the body to the brain without interference. That's our basic chiropractic and postural physical therapy rehab. This is going to be our neurological and brain-based therapy approach, and then this is our nutritional or our metabolic approach. And when you take all three of these and you put these together, you kind of hit that sweet spot, and that creates the environment where the body can heal. Now, the brain includes a lot of different areas. It also includes emotional aspects, stress reduction aspects, positive mental attitude, so on and so forth. There's a lot of different things that go into these categories, but these are the three basic categories that we deal with in our office. I hope this makes sense, and we'll see you on the next video.